Alberta leads the country in cases with more than 1,600 today. Nationwide, 4,200 people tested positive and 42 people died. The number of Canadians fully vaccinated still hovers around 78%, but it's those unvaccinated ending up in the country's intensive care units. CTV's medical specialist Davis Favreau on the emergency strain.
The team running this intensive care unit at Hamilton General wants Canadians to see the reality about the fourth wave.
1, 2, 3, 4, 5, 6, 7, and then there's an eighth person there. It's a bit crazy that people don't believe it. This is real.
1/3 of the people here are COVID patients fighting for their lives, each one unvaccinated because they felt it was not important.
Some of the viewers that have those beliefs will be able to watch this on TV, and there's nothing unreal about these people, and they're getting sick.
So these are 2 COVID patients on life support.
On advanced life support, both are unvaccinated.
Doctors across Canada report the unvaccinated who get sick are younger and otherwise healthy patients.
That machine over there with the screen, so that's the ECMO machine.
Many are in their 30s or 40s like this man. Some need ECMO, equipment that puts oxygen into their blood because their lungs have failed.
There's a catheter the size of a garden hose in his neck, and there's a catheter the size of a garden hose in his groin. It takes the carbon dioxide out, puts the oxygen in, and then pumps it back into his heart.
And each requires a medical team 24/7, largely avoidable with vaccination, say doctors.
It's frustration with the individual choice that the patient made. It's anger with people posting on social media that COVID's not real or that vaccines don't work. That basically preys on vulnerable people who are trustworthy and forces them to make bad decisions that in some cases are lethal.
Some patients do express regret.
And a lot of people have been asking for vaccines right before they get intubated, but it's too late.
And the ongoing protests by anti-vaxxers and those who harass workers are disheartening.
They still think it's a hoax, and that honestly is a slap in the face to us after everything that we've been doing.
Yeah, a lot of this is sort of emotional, moral fatigue.
Frontline teams admit it's eroding compassion.
What's changing now is the empathy factor, when you know that many of these situations are very easily preventable.
Everyone here, I mean, all of these docs and nurses and RTs, all of them have been working harder than they ever have, and they're all tired. Yeah, so, I mean, there's not a lot of reserve left in the tank.
This unit, like many hospitals across the country, has also seen an exodus of staff.
They're always constantly calling for overtime, but we are burnt out. It's hard to come in on your days off.
And some say the health system is cracking under the stress with this plea to vaccine skeptics.
Our goal would be to increase vaccination, because vaccination is what's going to get us out of this. And so I don't actually care if people believe it's real or not, as long as they get a vaccine.
And just to underline, the medical team at the hospital confirmed they have yet to see a fully vaccinated patient end up in their ICU with COVID. Lisa?
So hard to see what's happening in the ICU. All right, Avis.